So it's a renal problem, renal pathology. Oh, wala pa. Sandali. So when you say diabetic nephropathy in patient, first this is a patient with diabetes, and the problem here is, di ba? Diabetic patient tends to have a damaged kidney. It will shut down, and patient will just undergo dialysis to remove a waste product, the blood. So what will you see in kidneys of this patient with diabetic nephropathy? Okay, at this magnification, okay, this is a scanning magnification. See, this is the cortical area of the kidney, and those round hyalinized areas are actually your glomerulus. Okay, those are your glomerulus, and those smaller areas, cystic areas filled with hyaline material, are actually your tubules. Okay, these tubules are filled with your casts. Okay, hyaline casts. And okay, so let's go at higher magnification. See, some of these glomerulus are completely sclerosed. Okay, you won't see any more structure, but some are, you can still see some remnants, okay, like this one. Higher magnification, okay, you can still see some mesangial cells. But what's important here are your hyalinized intercapillary structures, okay, and you call this what? This one hyalinized, this one is capillary structure, hyalinized areas, this one, okay? You call this your what? Kimmel-Steele-Wilson disease, okay? Those hyalinized area, Kimmel-Steele-Wilson, okay? This is your diabetic nephropathy, okay? Mostly, again, at low power magnification, most of the glomerulus are sclerosed. Okay, all of these are fine, and your tubules are filled with yung eosinophilic material. Those are actually, when you urinate in early diabetic nephropathy, you will see these casts. Okay, that's your diabetic nephropathy with Kimmel-Steele-Wilson disease. So, nodular sclerosis, intercapillary glomerulosclerosis, okay, diffuse glomerulosclerosis, okay. You just read your manual, okay. Next is chronic pyelonephritis, okay, M1091. So, when you say chronic pyelonephritis, it's the inflammation of your kidneys. Okay, let's go scanning magnification. See, normally your glomerulosclerosis, either it is because of inflammation, but oftentimes it is secondary to hydronephrosis, prolonged hydronephrosis, wherein your cortical and medullary tract are being compressed. Here, at higher magnification, Joel, Nandiyan ba si... Test. Ah! Okay. So, since this is pyelonephritis, okay, at higher magnification, what you'll see are remnants of kidney tissues, okay, and here you'll see some of your dilated tubules, and this looks like what? What is the similar structure? It looks like what? Diba? Thyroid tissue. Okay? So this is the thyroidization of your tubules seen in chronic pyelonephritis. Similar to your diabetic nephropathy, you will see sclerosed glomerulus, okay, and prominent, of course, your prominent this one thyroidization of your tubules. Don't mistake that for the thyroid, okay? You'll see inflammation around, and very important since this is pyelonephritis, okay, you'll see aggregates of inflammatory infiltrates, okay, like this one. Those black dots, okay, here, those are inflammatory cells. So those are lymphocytes, okay, aggregates of lymphocytes, and in many areas, these lymphocytes form nodules, okay, like here, okay. See, these are nodules. Lymphocytic nodules, inflammatory nodules, seen in your chronic pyelonephritis. And at the background, of course, this area here is made up of fibrosis. So, your chronic pyelonephritis, after hydronephrosis, there will be injury to your glomerulus and tubules, and destruction of many of your glomerulus and tubules, and will be replaced by fibrosis. And of course, you will have scattered dense inflammatory infiltrates, sometimes forming nodule. Okay, thyroidization of your tubules is prominent. So this is your chronic pyelonephritis. Next is Wilms tumor, 90, okay, M10 90. Okay, Wilms tumor is made up of 3 components. Okay, microscopically look for the triphasic combination of A, blastemal cells. What is your blastemal cells? At this magnification, everything is blastemal cells. Okay, those small dot-like cells. Okay, at high magnification, they are cells with darkly staining nuclei. Okay, and it shows no pattern. Okay? that is the characteristic of your blastemal cells. Okay? Ito, blastemal cells rin yan. Okay? It has no pattern. Look at the cells. High magnification. Wala pa na. Okay? And next component, the next component is your stromal tissues. Okay, your stromal tissues are the pink trabeculae. Okay, pink areas here. Okay, these areas, those pink areas. These are the blastemal cells. The pink areas here. Okay, so the stromal or spindle cells, which looks like fibrocytes or sometimes definite smooth muscle cells or skeletal muscle, okay, are seen. But here it's more of fibrous. Okay, as you can see, higher magnification. Those stromal cells are made up of, I think this is fibroblast, characterized by elongated cells with cigar shape or still also elongated nuclei. Okay, those are your stromal cells. And lastly, the one that is difficult to look for are your epithelial cells. Epithelial cells. Dapat magpakita agad sila. Okay. These are abortive glands. Okay. Lined by epithelial cells. Ito na label dito Wala. Okay, all are blastemal and fibrous. Okay, ito pa na po. Ganyan. Kaya natin scanning. Wala. Hanapin natin. Tsagaan natin. 1 more minute. Huwag muna kayong tumingin. Baka mahilo kayo. It should be mga gland-like structures admixed with your blastemal cells, but it's smaller and abortive. Dapat may equal siya.
Ano yung may stop tapos i-continue yung video? Kasi yung live mo pala kasi kaya i-combine yung iMessage.
It's like this. You will see a lumen, okay? This is a lumen sometimes filled with yung pinkish material, but you see radiating cells. Okay, this could be your epithelial cells. Okay. Anyway, I think I cannot find yung more typical. This somewhere here. May area dito. Okay, I'll just. Anyway, that's your Wilms tumor. Okay, blastemal cells, fibrous stroma or the stroma, and the missing epithelial cells. Okay. Where are you? Anyway, I'll look at it under some microscope and show it to you. Next is renal cell carcinoma. Sayang yung video. Okay, let's look at the normal renal tissue. Okay, at this magnification, you can see or identify those glomerulus plus tubules. And when we scan around, okay, what is this? What is this area here? Is this a tumor? Do you think this is the tumor? No. This is the medullary area of the kidney. Okay, let's scan around. Still scan around. Okay, this one. Do you think this is the tumor? Yes. Okay. So this is renal cell carcinoma. Okay, at higher magnification, okay, there are several components or types of renal cell carcinoma. The most common is your clear cell pattern. Okay, meaning to say, the cells shows clearing of cytoplasm, like this one. Okay, at higher magnification, this is the typical picture of that clear cell pattern, wherein you'll see, okay, proliferating cells with round to ovoid nuclei, and you'll notice that the cytoplasm is cleared out. Okay, this one, like this one, it's cleared out. Okay, this makes the tumor light in color, and that's why it is called clear cell. Okay, there's clearing of the tumor, clear cell carcinoma. Other tumors or other types are your papillary type, meaning to say you will see papillary structures, the chromophobe type, wherein it's not clearing of the cytoplasm, but the cytoplasm is more plump and eosinophilic. Okay, and the last is your collecting duct carcinoma. Okay, it's anaplastic. You will see more anaplastic cells there. Okay. So, just remember this one. This is your clear cell carcinoma. Okay, let's go back at scanning magnification. Okay, see, there is clearing of the tumor, clear cytoplasm, and if you compare this with your normal, okay, this one is a little bit darker with prominent glomerulus, but this one is clearing of cytoplasm, and the tumor is pale in color. Okay. Next is urothelial transitional cell carcinoma. Okay. When you say urothelial or transitional cell carcinoma, this is the most common tumor of the lining epithelium transitional cell. Okay. So your transitional cell epithelium lines what? Your urethra, your bladder, urinary bladder, your urethra, and the pelvis of your kidney. So in these areas, you'll see this kind of tumor. Okay, but this one is very common in the the urinary bladder. Okay, what you'll see are in urothelial carcinoma. Okay, see this one at low magnification, it's mostly it is polypoid. Okay, you will see papillary projections like this one. Okay, this one it is also papillary projection, and this papillary projection, if you look at this at high magnification, look at the lining epithelium. Okay, notice that the lining epithelium still resembles the transitional epithelium, but the main difference is that the number of cells, okay, in the epithelium, it is much thicker. The cells are thicker up to about 10 cell layer. Okay. Normally in the normal transitional epithelium, the cells is only about 3 to 5 cell thick. Okay, but this one is several cell thick, more than 10, I believe. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. And at higher magnification, like this one, you'll notice that the cells already show some changes. They vary in size. Okay. Here, there are smaller nuclei, larger nuclei here, comparing these two. So there's anisocytosis. Okay. And also you will see this structure. This is already mitosis. Okay, this is your transitional cell carcinoma. Okay, it is divided into two types. Actually three. The one is benign papilloma. The other one is low-grade urothelial carcinoma, and more ominous one is your high-grade urothelial carcinoma. In your lecture with Dr. Gonzaga, I think it was there was a differentiation of the two. Okay, in low grade, okay, you can still see that it resembles the transitional epithelium. But in high grade, okay, there you will see more pleomorphism, more mitosis. Hindi mo na siya makikilala. You will not know that the cells are originates from transitional epithelium. Okay, it looks like it will look like a high grade malignancy. Okay, and oftentimes you won't see those papillary structures anymore. And in high grade urothelial carcinoma, there's fusion of this papillary structure. Nagdidikit-dikit na sila. They adhere to one another and they form one solid tumor. Okay? So remember this transitional urothelial carcinoma here. In some areas, they already form a solid. This is already a solid tumor. Okay? So there are areas that are really high grade in nature. Okay, if you look at this one at high magnification, you won't. This is already high grade. The first one, it's a low grade. It depends on the majority component. But this one is high grade. This is a feature of high grade. You don't see any resemblance to the transitional epithelium. Okay, the cells are diffusely proliferating, and you already see macronucleoli, okay, and somewhere you'll probably see new mitosis. This is already very large nuclei. So pleomorphism. This is your high-grade urothelial carcinoma. The papillary ones that you see earlier are features of low-grade urothelial carcinoma. Next is nodular hyperplasia of the prostate. So nodular hyperplasia, benign or malignant? It's benign. Okay. So in nodular hyperplasia, the proliferating cells are both the glandular component, this one, those acini, okay? And of course, the fibromuscular component. Both are proliferating because both have receptors for your dihydrotestosterone. So they are, when there's increase in your dihydrotestosterone, they will be activated and they will proliferate. So, okay, it is called nodular because with the proliferation of acini, okay, like this one, and your fibromuscular layer, they form nodules like this one here. Diba? They form nodules and proliferating glands. Okay, here is another nodule. Here is another nodule and another nodule here. And of course, there's proliferation of your fibromuscular layer here. Okay, so if you look at the glands, okay, of hyperplastic, you'll see hyperplastic glands like this one. Okay, this is one gland. Okay, you notice that there's an increase in the number of cells, and because of this, there's population inside the lumen. Okay, papillary hyperplasia. Okay, intraluminal projection of the epithelium. So there's hyperplasia of the glands. Okay, increased number of cells, increased number of glands, also increased number of stromal cells. This is your nodular hyperplasia of the prostate, and this is commonly seen in what part of the prostate? Central, peripheral, or transitional zone?
Central.
Central zone. Benign central zone. Malignant adenocarcinoma of the prostate usually originates at the periphery of the prostate. Okay, and that is our next slide. Adenocarcinoma. See, earlier that's benign, and this one is malignant. Okay. Okay. See, fibromuscular layer, but as we go around, you'll notice that this is somewhat benign, but as you can see here, the glands have thick walls. The cells are several layers thick, including this one. But what is important, so you can identify that this is, okay, again, very thick layers of epithelium. That this is malignant is that you should see glands in back-to-back arrangement, like this one. See? Kanina, di ba, sa adenoid cystic, you see cribriform pattern. Also here, you see those cribriform pattern. At higher magnification, you'll notice that it doesn't only form yung intraluminal projections, but here, there's already connection, okay? May nagdidikit-dikit na yung intraluminal projection, and it forms now several glands, okay? Smaller glands within one large gland. That is your cribriform pattern, okay? Glands. So, this gland, this gland has a common wall with this gland, and then so the glands are in back-to-back arrangement, and they fuse to one gland like this one. This is one gland, another gland, but the wall of these two glands are the same. Nagkakaroon na sila. And this is what you call cribriform pattern. Okay? So if you see that, that's already malignant. Okay? Your problem now is to identify the organ. So this is your adenocarcinoma of the prostate. How do you grade adenocarcinoma of the prostate? What grading system will you use? Letter G? as in Gleason's scoring, Gleason's grade. Okay? Your Gleason's grade, if you look at your books, it has 5 patterns. Okay, grade 1, individual malignant glands, individually infiltrating, so there's no fusion, but you'll see that there's a typical columnar epithelial lining. Grade 2, you see closely packed glands. They are seen in back-to-back arrangement already. Okay, some shows fusion. Grade 3, you see fusion of this gland. Okay, more fusion. Nagdidikit-dikit na yung gland. They are compactly arranged. And grade 4, you already see this cribriform pattern. Okay, this is grade 4. And you also see some diffusely infiltrating cells. While grade 5, it's a pattern that is, the cells are seen infiltrating diffusely. You don't see glands anymore. What you see are infiltrating cells. That's 5, Gleason's grade 5. So, to give a diagnosis of, Gleason's scoring is made by adding the more prominent and the less prominent structure. So, if you see, halimbawa, this one is Gleason's 4. This is the most predominant pattern. And you also see some pattern that, like this one. This is just an example, okay? You see pattern that are medyo, the glands are closely packed, probably like this one. Probably this is grade 2, Gleason's grade 2. So, or grade 3, this is grade 3, okay, closely packed. So, you have 2 patterns already. One is grade 4 and one is grade 3. You have to add this, okay? 4 plus 3, so your Gleason's grade is grade 7, 4 plus 3. Okay? Kailangan dalawa. I-add nyo yung dalawang predominant and less predominant. So, that's your Gleason's scoring. Okay? So, that's it. We only have one problem left. The epithelial cell. Sana.
If I don't show it, I'm dead.
Anyway, tingnan nyo na lang sa libro niyo. Ay,
I found it.
yes, this one. Okay. I think these are your abortive epithelial cells. Before we've seen this one, like this one. You see, this is lined by epithelial cells. It is a gland. Also, this one. Okay. These are the lumen of the gland and surrounded by epithelial cells here. This one has a pattern. You will see the pattern. Okay, it's going around. The cells are going around the lumen. The blastemal cells doesn't have any pattern. They just grow randomly. But this one you see glandular formation. If you see this, that's the epithelial cells. Okay. Okay, this is also epithelial cell. Yeah. Medyo a little bit of your imagination is needed. Under the microscope, this is more, this will be clear. Okay? I think that's it for your renal. Good luck.